Hospital beds for sick children are in short supply as an early virus season is hitting hard. Some major pediatric hospitals are reporting an unprecedented surge in patients. And tonight, a Toronto mom is speaking out about the stressful experience of getting her toddler treated for double pneumonia.
The emergency room was chaos. There were so many people there.
Stefania and her daughter Lily arrived at Sick Kids Hospital on Sunday evening. Her 2-year-old was having trouble breathing. She tells me the emergency department was crammed. It took hours to be triaged, and once the doctor decided Lily should be admitted, it took another 14 hours to find an available pediatric bed.
They said that they were going to try to find somewhere in community because they're overrun in some other peds unit, but they were all full, I guess, in all of the other community hospitals, and we were very fortunate to get a room here.
Stefania understands the pressures these hospitals are under and is grateful for the care her daughter is now receiving, but worries the healthcare system is about to crumble.
I spoke to the nurse this morning. I was like, how are things going? She's like, it's crazy. Like, we discharge a patient and then within minutes, there's another patient that comes back up. They're worried about what actual flu season will look like.
Other pediatric hospitals are also seeing crushing demand. The Children's Hospital of Eastern Ontario reported its busiest September on record. An early surge of a common infection known as RSV is being blamed. And according to CHEO, the number of admissions is 10 times higher than the average before the pandemic.
In the last 3 years, we've had with COVID and a lot of our lockdowns and kids not interacting in the same way. RSV is a virus that normally you probably are in contact with every year or every other year. And so you sort of accumulate an immunity over time. And what we're seeing is this cohort of kids who have had much less exposures to viruses as would have had in the past years.
RSV usually comes with a fever, cough, and congestion and is normally worse in babies and toddlers, but most cases can be treated at home. The symptoms to be concerned about are breathing issues and lethargy, and Dr. Melissa Langevin says the infection is persistent.
The peak tends to be on days 4 and 5. So this is one where when you expect things to be getting better, it in fact peaks. So it's good to know that this usually gets worse before it gets better.
As for 2-year-old Lily, she is slowly recovering, likely from a case of RSV. Her mother tells me they are expecting to be here at Sick Kids Hospital for the next few days. Shauna Hunt, CityNews.